Good afternoon, and thank you for joining us on the program Healthy Living. I'm Adesuwa Osa Owage, and I'm here again with my small red book that I use in writing everything that I want to write when it comes to the issue of health. Today on the program, we want to look at cardiac arrest. What is cardiac arrest? What are the signs and symptoms? How do you know that you have cardiac arrest or that you may have cardiac arrest? These are many more we're going to be looking at today with an expert in that field. Is going to be discussing with us today. Please join me as I make welcome Dr. Egbodion Osage. Is the senior registrar at the cardiology unit, yes, at the cardiology unit of the University of Benin. So he is a cardiologist, simply put. Hello, doctor.
All right, so thank you. Good afternoon.
We'll meet again. Yes, thank you. So we're looking at cardiac arrest. You know, sometimes you just hear, the person died as a result of cardiac arrest. Is this something that one should be wary of? What and what should we know about cardiac arrest? So tell us, what is cardiac arrest?
All right, thank you very much for having me once again. Cardiac arrest is a sudden loss of consciousness with evidence of no respiratory or cardiovascular activity. Usually, you see somebody discussing, all of a sudden the person just goes off, loses consciousness, falls down, and when you check, there is no pulse. When you check, there is no respiratory activity. And usually occur within minutes to hours. And if urgent resuscitation is not given, if urgent medical attention is not given, the patient dies. So it's one of the most common medical emergencies that we have. Okay,
no signs, no symptoms?
Yes, usually it doesn't come with any symptom. It doesn't come with any sign. Oh, no doubt, patient might have a pre-morbid state. What I mean is that a patient will have a long-standing illness or ailment. For example, somebody could be hypertensive, diabetic, could have heart pathologies, could have heart failure before, could have heart ischemic heart disease, could have myocardial infarction, what we call heart attack. All of a sudden, the person just loses consciousness. So that's it might not come with any warning sign.
You know, it's very alarming when you just see somebody suddenly drops down and die as a result of cardiac arrest, and you begin to wonder, did the person not get signs? You know, like somebody who is hypertensive, at what point would that person, or when would that person likely come down with heart attack or heart cardiac arrest, as the case may be, as we use it interchangeably?
Like I said, one of the the commonest cardiovascular problems that we have is hypertension. And hypertension, like I've said in our previous episode, it's a silent killer. It usually will not tell you or give you any sign. And most times, these patients who are hypertensive, they will develop cardiac arrest when either the blood pressure at that time is extremely high. Imagine a patient's blood pressure is reading over 200 systolic, over 120 diastolic. The chances of that patient or that individual having cardiac arrest is very high. Or, for one reason or the other, the blood pressure drops so sudden, what we call hypotension.
Okay.
Person goes into shock. That person is likely going to have cardiac arrest. So, these are things that occur in an individual who has hypertension. Either the blood pressure is extremely high, usually above 200 systolic, 120 diastolic, or suddenly the blood pressure drops for one reason or the other. So hypertension could be a cause of cardiac arrest.
Okay, you know, most times you see people say, do not live sedentary lives. You have to be very active so that everything in your body will be working, your blood will move flow, your heart will pump blood, you know, very well. You just be fine. But surprisingly, we see that some sportsmen also fall into this situation of cardiac arrest, and they might just be running on the field. We heard of somebody the other time, Sam Okwaraji, who was a known footballer. You know, in active service, somebody just turns and dies. And then you see somebody just running, you know. I've had instances of sportsmen being rushed off the field because of cardiac arrest, you know. If somebody who is so active can fall into that situation, then how do we explain it?
All right. You see, like you said in the first statement, they discovered that it's usually said that those who live sedentary lifestyle are more likely going to develop cardiac arrest. Note that the reason is not far-fetched. Somebody who lives a sedentary lifestyle, usually we have higher risk of developing myocardial infarction, which we call cardiac heart attack, because the blood flow to the heart itself is supplied by blood vessels. There are some blood vessels that supply the heart. So a patient or an individual who lives a sedentary lifestyle, there are clots, what we call clog of blood, can occlude the vessels to the heart. So
that is to block it.
Yes, it will block the vessels to the heart. So that individual will have sharp, sudden chest pain, and as such can develop cardiac arrest. That is for individuals who have the sedentary lifestyle, amongst other risk factors like obesity, diabetic mellitus, hypertension, other. Now, why do people who also live active life have cardiac
those who don't have any ailments, so to speak, you see them strong?
Yes. Remember I said in my opening statement that people who develop cardiac arrest could have underlying heart problem that we might not know, you might not know about. Athletes.
Is it possible for the athlete not to know?
Yes, yes, it's possible. If you've not done your investigations, you've not gone for a clinical examination, you have not gone for any investigation, you wouldn't know. There's what we call hypertrophy cardiomyopathy.
And that is what?
It is a, how would I put it, is a defect in the heart muscle. Okay. It is hereditary. It is something that comes just with birth. So there's nothing you can do about it. What happens there is that the heart muscle is so thick, the muscles of the heart is so thick, so the lumen or the lumen of the heart is so small, so the heart cannot contract adequately.
But what is that lumen, doctor? So tell us in simple language.
That's the parts where the blood flows through the pipe.
Okay.
So there's usually a ratio between the muscle wall and the space, as the lumen. Okay. Now the wall is so thickened. Before you know it, the patient will have what we call arrhythmia. Because one of the things that usually we call as cardiac arrest is arrhythmia. Arrhythmia is abnormal beating or reading of the heart. So you will see an athlete as Okum, that's hypertrophic cardiomyopathy, not known to him or anybody. What happens is that just in the process of running, playing football, doing any active sport, he falls down and dies. So when you go and do a pathology in terms of autopsy and all that,
at least you have a closure.
You will now see that, check the heart muscle, very thick, very thick. So people could have underlying heart diseases that are not known to them. They are not symptomatic until probably something will trigger it off. So they will now have abnormal heart rhythm. Because the heart is supposed to contract, beat at a regular pattern. Yes. So when it's not now beating at that regular pattern, which we usually call arrhythmia, it can trigger the heart, and the heart can go into an arrest.
All right, you know, all of this, we have to do it so that you and I can live as long as, you know, God gives us life to, but we should also do our best to make sure that we live healthy. For those of us who are not in the habit of going to the hospital, please learn it. Anything can happen. If you see that your heart is beating abnormally, it's not beating the way you want, you should not hear your heartbeat. That's what you said. One of you said the other day. Yeah. You should know, because some persons will say, okay, I see my heartbeat. You shouldn't say it, all right? You should feel it. But when you start saying it, it's time to go to the hospital, okay? And when you notice any abnormal thing about you, not necessarily your heart, anything abnormal, because diabetes can trigger it, hypertension can trigger it, and there's nothing anybody can do about that. It's only you who can do something for yourself. So do yourself a favor. Every of your birthday, you know, give yourself a gift by going to the hospital to do a comprehensive check. All right, you would love yourself even better when you do that. Now, we say heart attack, we say cardiac arrest. Are we talking about one and same thing?
All right, heart attack, cardiac arrest are common terms that we use. But I think I'll talk about cardiac heart attack. Heart attack is what we doctors will call myocardial infarction.
Okay, myocardial infarction.
I did say that the heart itself is supplied by vessels itself. There are different vessels that supply the heart. When those vessels are occluded, that is, they are blocked.
Yes.
Either by a clot.
What could block those
There are so many things
passages, those veins that carry the blood? What could block it?
Yeah, those vessels. Yes, those vessels could be blocked by one blood clots. For example, there is what we call laminar flow. The blood is supposed to flow at a particular velocity and rate.
Okay.
A particular rate. For one reason, probably the patient has, for example, the heart is not beating regularly as it should be. Those vessels the blood could flow very slowly, and as such, they can clot. That's one. Two, when there's a turbulent flow of the blood itself, it can trigger a clot. Also, we talked about what we call hyperlipidemia, cholesterol. Those things can go and block the heart. Fat can block those vessels. So when those blood vessels are blocked, that is what we call heart attack. What happens? The patient is our chest pain, severe chest pain.
Just imagine the pains.
The individual can fall down, can drop, just like that.
But would the person die?
Of course, the person can die from there. The person can die from there. Now, when we now talk about cardiac arrest, it's an abnormal contraction of the heart that leads to loss of consciousness. Oh, somebody can have heart attack and still be conscious, still be conversing, chest pain. Somebody who has cardiac arrest cannot even communicate. There's loss of consciousness, there's no respiratory activity, there is no pulse, that's cardiovascular activity at all. So it's just like a prodrome to death. That's the truth. Because if within minutes nothing is done, no resuscitation for that patient, the patient dies because the brain cells needs glucose.
And this is a country where ambulances don't function.
That is another thing. Because you have to do what we call CPR, cardiopulmonary resuscitation, for that individual immediately.
And it's not everybody that can do that. I think it's something that everybody should learn.
Yeah, I believe in the course of this our discussion today, we're going to discuss some of these things. So now we can resuscitate.
Why do children suffer cardiac arrest?
Same reason. So same reasons I've given.
So children
could have underlying pathology in the heart disease. Remember I said in the previous discussion that children will have heart disease, what we call congenital heart disease. Congenital heart disease can also lead to what? Cardiac arrest. Yes, they can have it.
That's quite
so
pathetic.
It's not limited to any age, any sex, any religion, ethnicity, or whatever. Any individual could have cardiac arrest.
So what are the things we should look out for now?
All right.
To save us from cardiac arrest.
Yes. What we should look out for, personally, we need to look out for warning signs. I did say that sometimes this thing will come without warning signs. However, there are some things you have to look out for, some warning signs. Like, for example, you hear your heart beat. Ordinarily, you should not hear your heart beat very fast, except you are under tension, flight, you are emotionally unstable.
Ordinarily, you shouldn't.
That's one. When you start hearing your heart beating fast, it's a warning sign. That's what we call palpitation. Two, the heart should beat at the rate of 60 to 100 per minute. So if the heart is not beating faster, that is more than 1 100 beats per minute or less than 60 beats per minute, it's a
minute.
warning sign that there is something wrong.
Unfortunately, a lot of us will not even know that.
Yes, well, it's true. It's difficult to know, except probably you have the gadget, the SIG, that you can use to check your blood pressure. We can also give you the pulse rate. If not, it might be difficult. But with that palpitation, chest pain, oh, you're feeling strained chest. Sometimes, oh, probably when you just walk at this time, you feel chest pain. It's already a sign that there is something wrong. Or you notice that you get dizzy.
Okay.
Just stand up for a chair, you notice that your eyes are turning you, or you're having frequent fainting, what we call syncope. Okay. You are fainting today, tomorrow. It's a sign that there is something wrong. So it calls for medical attention. So these are things, but most times we overlook these things.
We just don't overlook
these
them.
things. So, but when we pay rapt attention to our body signals, we discover that these warning signs can be picked at the early stage. Okay, so where there is no doctor, what do we do before we get a patient to the hospital? Yes, that comes to what should everyone know about how to help an individual who has suddenly developed cardiac arrest. Okay. That's what we call cardiopulmonary resuscitation, CPRO. It is a procedure. Is it not that one that you now? Yeah, exactly. Wait, I will discuss. I will tell you some of these things. This is a procedure everybody, learned, not learned, educated, not educated, doctor, not doctor, should know and know it well. Because not knowing it well is equivalent to not knowing it. Because remember, the goal is to keep this patient alive. So what is it all about? You are walking in the streets and suddenly somebody drops. What do? Immediately go to that scene first, ensure that everywhere is safe, that you yourself, you are not in danger. Hopefully, because what Nigerians will do is pick up their phones and start making calls. And start recording. Oh, okay. I ever thought they would start making calls for help. Okay. In fact, they need content for social media. For social media. That's very bad. The first thing you want to do, you want to be sure the environment is safe for you, yourself, and the individual who has the cardiac arrest. The next thing is you want to be sure the person is even alive. Okay. Especially when the person did not drop in your presence. If the person did not drop in your presence, it might be difficult to tell if that patient is even alive or not. The next thing you want to do, you tap him. Hello. Oh, let's assume if you don't know the person's name, no problem. Mr. Ma. At the same time, you want to feel the pulse. That's the central carotid, yes. Any of the place. Okay. Whether left or right, you can use preferably the right or the left, anywhere. Okay. Just check the pulse. Just to feel the pulse. You just feel the pulse. Okay. At least for a few 10 seconds. Remember, you are also checking the respiratory, checking that the patient is breathing or not. If the patient is not breathing, what do? It means, therefore, that this patient has had cardiac arrest. Immediately you commence your CPR while calling for assistance. Obviously, you might not be able to do that alone. What is it all about? It's a simple procedure of chest compression and ventilation. What you do, fix your hand, your elbow joint should be locked. You compress the chest. Which part of the chest are you compressing? The lower to third of your sternum. I hope you know the sternum. That's the breastbone. Bone, yes. Yes, the lower to third. That's where you put your fist hand. I'm just trying to imagine that person is a woman. These are challenges, so of course there are these are part of the challenges you have when resuscitating a patient. Yes, you compress for 30 compression. As you give 30 compression, yes, 1, 2, 30 times. You must ensure that the chest is moving, as you recall, at least about 5 cm depth. You understand? That's 5 cm is about 2 inch, I mean, to 2.5 inch. You compress and ensure that there's a recall of the chest, of the breastbone. Having done that, you give your ventilation, your oxygen flow. That is, that's the discussion I want us to come. How did you do that? Because most times in the streets, you wouldn't have. So people would not talk about it. That's why they talk about mat-to-mat resuscitation. Yes, but you just have to, if you know the patient, if it's your relative, you know that the patient is not it does not have any airway disease or para-airway disease, of course, no COVID now, you can do that for the patient, just to save the patient's life.
I think we were taught by UBTs to put a clean hanky over the
Yes, that's another, yes, exactly. In fact, in developed country, in developed countries, these are things, there's a vacuum ventilator, just so, you can use for any person that has developed cardiac arrest. But if you don't have that, oh, good, you are clean hanky, you can blow it. Or what do you do? 30 compression and 2 breath. 30 compression, 2 breaths. That is what you must do for a patient continuously. Continuously. Remember, you've called for help. So that is a basic, that's what we call basic life support.
We call for taxi or bus, because if you say ambulance, I don't know about that. Because that's something we should have in every emergency case. We should be able to dial 911. Like
yes, of course.
But if you dial our own emergency numbers, I don't know what will happen. All right, doctor, we're pressed for time. I want to say thank you for finding time to come and educate us today on the program Healthy Living. For you out there, I'm sure you have learned one or two. Just learn it. Do yourself a favor, okay? We don't want you to suffer unnecessarily, something you can easily avoid. All right, do yourself a favor by going to the hospital. And we also want to appeal to the relevant institutions or authorities involved to make ambulances available everywhere, so that in case of emergency, you can just quickly dial, if not 911, let's have some, because I can't remember that about, I think ours is 112 or something like that, but it is not functional, okay? So let's put all of this in place and have a healthy Nigerian and healthy citizens. Thank you, doctor, once again.
You're welcome.
We'll see you again on Monday. Bye.